talking about a condition that affects 1 in 10 women between the ages of 15 and 44, polycystic ovary syndrome. It's a condition that affects a woman's hormone levels. It can lead to infertility, the development of cysts on their ovaries, acne, and an excessive amount of hair. So joining us this morning to talk about this and to find out a little bit more about the condition and how women can really take the power back is Hillary Leibowitz-Schaefer of Lébo Skincare Center and Flor Castillo. Is it Castillo?
Castillo.
Okay. Now, you've actually been dealing with polycystic ovary syndrome for much of your life.
Yes.
Really? So tell me about that. 1 in 10, it's a lot of women. How did you first learn that you even had PCOS?
So it started in my teenage years. I started developing acne at the age of 13, and as the time went through, weight gained, and then the years went by and excessive hair growth began. So that's when I started noticing something was wrong. So we went to the doctors, and the doctors diagnosed me at the age of 14 with polycystic ovarian syndrome. Let's
talk about the excessive hair, though, specifically. Are we talking on your face or on your arms? Where do you typically see that?
Well, many women.
Where did you see it?
Many women can have it all over their body.
Okay.
My excessive hair growth was my facial hair.
Right, which as we get older, we realize we get some fuzz, but this was more than that at a very young age. So it caused you to be concerned enough to go to the doctor and figure everything out. Side effects can be extremely serious. I mean, it can lead to depression. A lot of women don't want to leave their house because they just feel, so awful, and they feel awful. They think they look awful, but I would imagine hearing a diagnosis like that, especially at a young age, would be pretty challenging. Would you agree?
Yes. So for me, I typically hid myself during the day. I would wear a lot of scarves, and I did not want to attend activities during the daytime because I felt like people were staring at me, my facial hair. During school was hard as well because bullying affected it, so it was harder for people to look at me and not look at my facial hair.
Oh, I can only imagine. We do want to talk about what can be done about this, and I know you guys probably see quite a few women come in with this problem.
Yes, definitely.
So how big of a problem is it?
It affects a lot of women, obviously 1 in 10 women.
Sure.
And most of the women that come in to our office to consider laser hair removal, they do have the issue of the facial hair, and some of them, when they come in, they don't realize that it could be from polycystic ovarian syndrome. They just think it's just facial hair. There's a lot of women that are not diagnosed.
Really?
So when they come in, we ask, do you have hair in other places? And we talk to them about seeing their family doctor or their OBGYN or their endocrinologist. There's several different paths they can take to see if they have it.
So you guys are actually taking that step past just doing laser hair removal.
Absolutely.
You're talking to the patients and figuring out and helping them if that is the case. That's amazing.
Well, because your body is going to want to keep producing hair if you're not figuring out the root cause of it.
So
sometimes you can work in conjunction. Other times, some people choose not to go the route of medication or putting it under control in other ways. So then we just do laser hair removal, but sometimes it's working in conjunction.
All right, let's talk about the laser hair removal. How does that work? Is it a series of times you have to go? How often? How frequent?
We always recommend, because hair grows in stages, and there's 3 different cycles to a hair growth cycle, or a follicle, and the way that it produces hair. So you want to hit each cycle twice. So we always recommend 6 treatments.
Okay.
After 6 treatments, it's a maintenance depending on your body. If you have somebody that has polycystic ovarian syndrome and they either aren't on medication, or maybe the medication's not doing as much to keep it under control.
Sure.
You have thousands of hair follicles in 1 square inch. So you can produce out of another follicle that hasn't produced yet.
And we're looking at video right now. Explain what's going on right there.
So this is actually Flor being treated right now, and you
Okay.
can see how the laser is emitting a light. That light is attracted to the pigment or the melanin that's in that hair at the time. And when that hair absorbs that light, it sends a lot of heat into that follicle, and it destroys or damages the hair follicle.
Is it a painful process?
How would you describe it, Flor, since you've had it done?
It's not. It's like a rubber band hitting your skin.
So just a little snap.
Just a little snap.
Yeah.
But the staff constantly ask you if you're comfortable, if you need a break, and they compress like a cool towel, paper towel on your face, so you're constantly not,
not worrying about pain at all. Yeah. Can this be done for anyone typically? Are there any limitations to it at all?
Laser really only works on black or brown hair. So if it's white, gray, or blonde, because there's no color in that hair, the laser can't, that light can't be absorbed by it. So that's one of the downsides, to it. But on the positive side, it does work on black or brown, which tends to be more visible.
Sure.
So
that's the one you really want to get rid of.
Absolutely, and you don't want to have a tan at all when you have the treatment.
Okay.
Because then your skin has that pigment, and the laser can see that instead. So you definitely want to have.
No,
your
if
natural
someone
skin
doesn't
color.
have polycystic ovary syndrome, I can never say that. PCOS. Would it not come back as fast? Like how you said 6 treatments, but is that over a couple years typically, or it just depends on the person?
Depends on the person.
Okay.
Typically, when you're dealing, it depends on body parts. I find more than anything. We've been doing it for 20 years, so we've seen lots of different cases. Yeah. If it's facial hair, we usually see through the 6 treatments about every 4 weeks.
Okay.
If it's more like legs or back, it's more like 8 to 10 weeks apart, because it just takes longer for that hair to kind of get into that next cycle.
Right, but especially for people who are constantly having regrowth,
absolutely,
that can be a huge amount of time to not have to worry about it.
Right, and then once they go through those 6 treatments, the maintenance for somebody can be so different. I see some women that come in, or men, it could be once every 2 years for a few hairs.
Yeah.
Others come in maybe every 3 months for more of a maintenance. So it depends on their body and what's trying to produce hair.
And obviously you've been really happy with the results.
Absolutely.
Yeah.
It's built such a confidence in me, and I get to share my story with other women who are going through it and are ashamed to see that this is actually a condition.
You have to talk about it because it takes away the bad stigmas that are assigned to it that we all hear so often. Thank you, ladies, so much for coming on. Thank you.
Thank you
for being brave enough to talk to us this morning. No reason to be ever ashamed of talking about it. Thank you both so much. If you do feel like you are a woman and experiencing excessive hair, obviously you want to see a doctor first, or go to Lébo. They will talk to you about seeing a doctor first. But if someone is interested in laser hair removal, Hillary, tell them how they can contact you guys.
So they can go to our website, which is www.leboskincare.com, or they can also just directly call our office. We have 2 locations in York and in Hanover.
Love the office. Love seeing you ladies. I'll have to come visit you soon. Thank you so much. We're going to put all of this on our website as well, fox43.com. Thank you both for stopping by.
Thank you.
We'll be back after this.